So our next speaker is Xuxiao Chen, and the title of his talk is Improved Liver Segmentation and Volumetry with Spectral Detector CT and MADplot. His mentor is Julia Fielding. I believe you're a medical student, is that correct? Correct. Yeah, okay, so we have to cut him a break because he's just a medical student.
Thank you for the introduction, Dr. Linkinski. So first, I'd like to thank all my fellow collaborators in the Spectral CT group for giving me the opportunity to work with them on this project. So just an introduction. So accurate liver segmentation and volumetry are essential components for the preoperative imaging workup for liver transplantation. Currently, the most accurate technique is manual or hand segmentation, which is a very tedious and time-consuming process that involves drawing ROIs around every image of the liver across all slices. Automated liver segmentation methods have been developed and traditionally use Hounsfield unit attenuation, but it's very prone to errors due to the heterogeneity of Hounsfield unit measurements within any given slice. So therefore, there's a need for a liver segmentation tool that is both time-saving yet accurate enough for clinical use. Yes. So the technique that we propose is termed the MADplot. Sorry, just give me 1 second. Yeah, the MADplot technique. And what basically this is it takes advantage of a dual energy CT technology, such as spectral CT, to separate X-ray attenuation of matter into its fundamental components, the photoelectric and the Compton scatter effects. So what this means is every pixel on a spectral detector CT image can be separated into these two characteristics and then plotted based on these values and on a 2D histogram termed a MADplot. So this is kind of what a MADplot looks like. This is an illustration of the MADplot. On the x-axis, you have the Compton effect. On the y-axis, the photoelectric effect. And this is where typical compounds that you find in clinical imaging would be located, on this axis. So with lung and then contrast, such as iodine, calcium, and then soft tissue kind of in this area. So what we propose is that using this technique, this MADplot technique that takes advantage of spectral detector CT, we can separate liver parenchyma from adjacent structures. And we hypothesize that our method will be superior to Hounsfield unit-based techniques when they are assessed against the gold standard of manual segmentation. So our study design, so in this HIPAA-compliant IRB-approved retrospective study, we took images from a heterogeneous group of patients that were undergoing CT scans not evaluating the liver. Across this span of time, these are our scan parameters, and we chose to exclude livers that were abnormal, overtly abnormal. And from this, we were able to obtain 30 livers randomly. We chose them randomly from the eligible criteria. These 30 livers were segmented using 3 methods: manual hand segmentation as a gold standard, and the 2 experimental methods, the Hounsfield unit-based segmentation method and our experimental method that we proposed, the MADplot-based segmentation method. So this is what the MADplot would look like in actuality. So this is kind of like where the lung and the air tissue would be. Here is where kind of the soft tissue characteristic values would be for this image right here. And this is what, so what we have found is that this particular area here on the MADplot, so this corresponds to this area here, actually corresponds to the liver. And the way that we can take advantage of this fact is that the user can input a specific region of interest within the liver, so this is semi-automated, and then that will correspond to a particular set of Compton and photoelectric coefficients within this area of the MADplot. And then what we can do is select this entire island of Compton and photoelectric coefficients, or coefficient coordinates, and then use that to reverse map to the entire liver. And that produces an accurately segmented liver. So we chose to assess this method against a Hounsfield-based method on 2 metrics: volumetric accuracy as determined by Bland-Altman plots, and segmentation performance based on dissimilarity coefficients. So this is just an explanation of the dye similarity coefficient. There's the overlap between the two livers. So this is the results of our experiment. So we have 3 images here, and it's the 3 different segmentation methods that we have used. So on the left here is hand or manual segmentation. In the middle here we have our Hounsfield unit-based segmentation, which you can see is kind of speckly. And this is due to the fact that a lot of pixels are excluded because there's Hounsfield unit heterogeneity within this image. So a lot of liver that has Hounsfield units outside of the range that it's determined is going to be excluded. And concomitantly, as you can see, there's some spillover into adjacent structures, such as the IVC in this image, shown in red, because it's within the range of what's considered liver. And in some other slides, there's significant spillover into spleen and abdominal wall as well. On the right here, we have our method, the MADplot segmentation method, which, as you can see, very closely resembles the manual segmentation method. And in terms of more strict characteristics, volumetric accuracy, both the Hounsfield unit method and the MADplot method correlate well against against our reference standard of hand segmentation, with only one data point, one liver on each falling outside 95% limits of normal, although the Hounsfield unit method tends to underestimate the true volume of the liver with a larger negative bias and has a larger spread, so it's kind of less specific than our method. But in terms of segmentation accuracy, the MADplot segmentation method consistently outperforms the Hounsfield unit-based segmentation method across all 30 patients. So this is just to summarize our results. We have a significantly higher Dice coefficient with our MADplot method than the Hounsfield unit-based method. So what we've been able to do is we've been able to develop a novel segmentation technique termed the MADplot-based segmentation technique using spectral detector CT and this principle of material attenuation decomposition, which separates each pixel into its photoelectric and content components. And what we've been able to show is that this method is superior than Hounsfield unit-based methods in providing liver volumetry and segmentation when both are compared against the reference standard of hand segmentation. And although not directly assessed, the MADplot method was rapid and significantly faster than hand segmentation, and we propose that this could be a potential clinical tool used to segment the liver. Thank you.
Thank you. Do we have any questions? There's a question. Ron?
Very nice talk. Did you get a chance to look at the effects of motion or other artifacts?
Everyone hear the question? Yes? The effects of, Ron asked about the effects of motion and other artifacts.
I don't believe that's something that we looked at exactly.
Yeah, I've got a question.
Sure, Neil.
You chose to do this on normal livers.
Yes.
And so the question, of course, is what happens in abnormal livers, because we're rarely interested in the normal ones. So what are your thoughts and what are the group's thoughts on that, number one? Number two, are the differences that we see, we can say that it looks better, is it clinically significant to drive a management change, or is it just a workflow issue? And I'm not minimizing workflow, it's very important.
Yeah, so to answer your first question, I mean, I think if we're looking at transplanting livers from a donor to a recipient, I think the donor liver is going to be normal, because the whole idea is that, we clinically, the surgeon needs to know exactly how much liver is going to be transplanted to the recipient, and then how much liver will be remaining in the donor, because that's really essential to assess the feasibility of the surgery and the survival of both parties. So I think, in terms of normal, I think the majority of our donor livers are actually going to be normal. And to answer your second question, I'm sorry, what was your second question again?
Let me think.
How accurate does it have to be to drive
that's right.
Clinical decision?
Thank you, Bob.
Yeah, because so I mean, if you look at the volumetric data, I mean, it seems like they're both estimate the volumes pretty well, but the segmentation performance is so much better. And I think there's a lot of there's a lot of work that can be done in the future, I think, to specifically explore our technique Because right now, we're able to segment the liver very accurately. And there's some work that we've been doing where we're able to actually use our technique to separate hepatic lesions, segment hepatic lesions from the liver itself. So, well, I think, you know, the improvement is significant. Our technique has a lot of ability, you know, in the future to, you know, there are a lot more clinical uses that we can do.
So just a comment, Neil. I mean, we think these livers are normal, but we're not able to do normals under an IRB. These are people who've come in for some other reason. We looked at the livers. I mean, someone looked. I didn't look at them because you wouldn't rely on my reading of them to know anything. But they're within a range of not having much pathology in them.
You know, one thought would be that if we really wanted to get at this in an experimental model, we could do this in an animal model, excise the livers and do a weight displacement volume comparison, and then you'd have a pretty good gold standard to compare it to, as opposed to the assumed gold standard. Just an idea.
There's another question there, Dr. Ng.
Dr. Ofsky, I just want to help him answer one of the questions that you asked. So basically, this is a pilot study where we pick normal livers, and we started that way because that's the lowest lying fruit, and we're starting to experiment with, you know, gradually more abnormal livers. For example, we are starting to look at livers containing hepatic tumors. We have good results, as Xuxiao said, that we are able to actually separate out hepatic tumors from normal liver parenchyma, and the way we do that is the first layer, we just separate out the liver, and on the second layer, we have a separate computation that separates out the different tissues into basically hepatic tumors versus normal liver parenchyma.
Okay, thank you for the comment. I think we ought to give this medical student a round of applause for the wonderful work that he did.